Hello. This video is for people dealing with low back pain issues, okay? That's now one of the number one reasons that I think I see people in my office, or like one of the number one things that people come in for or come in with, they, even if they're not coming in with low back pain, it's just so common that they come in to see me for one issue, and then, just in talking with them, it's like, yeah, low back pain is an issue. So, what I'm going to do here is a series of videos that show you a handful of things that you can do on your own to start to improve low back pain. There's a lot of reasons that low back pain can happen, and I'll just kind of break it down into two categories to help make sense of it for you. So there's structural and there's functional. Structural is kind of like it's the bones and the ligaments and the tendons, that sort of thing. It's the actual structure of your body. And so something like, if you have a bulged disc that's pushing on a nerve, that's a structural issue. There are some functional issues involved, like inflammation is a functional type of issue, but there's a structural issue where that nerve's being compressed and maybe you get radiating pain down your leg, if it's like your sciatic nerve, that sort of thing. Obviously, a fracture of the spine can really hurt, and sometimes there's things like a fracture, and issues on down the line, even after the fracture's healed, that can cause pain. But those structural issues are actually rarely the primary issues that I see. And even when there are structural issues, there's always functional issues related, and the functional issues are what I want to talk about because that's what we have a lot of control over. And surgical interventions are really rarely indicated for back pain, unless it's a situation where a nerve is being impinged so much so that you're going to lose function or something of that level of seriousness. Then surgery is really not a great option, and it doesn't improve things, or it commonly can make them worse. So there's four categories that I want to talk about with functional, thinking of back pain from a functional perspective, okay? So one of the things that contributes to back pain is poor movement dynamics and maybe like poor ergonomics, okay? So that's going to be one video, and I'm going to talk about that and show you what to be aware of and how to change some of that in your body. Another thing is the core. So this is not probably new to a lot of people that know about low back pain or have experienced it. Many of us have a kind of a weak core muscles, but also an inactive core. So just those muscles aren't being activated. I'll talk about that in a separate video. We're going to talk about the fascia. This is probably the number one reason that I see for chronic musculoskeletal pain, period, and it's hardly ever addressed, is the myofascial system. So we're going to talk about that and things that you can do on your own to address the fascial system. And then we'll talk about inflammation, because that's a real thing that happens and contributes to low back pain as well. So check out the other videos that are part of this. Again, this, in my office, I would be doing things like hands-on therapy. I do some regenerative injection therapies when those are necessary. But this video is for people who either can't see me in my office or just want things that they can do on their own that are going to start to improve their pain. So check out the videos, and I'll see you soon.